Hey guys, so today I'm going to talk about something a little more serious that I haven't really talked about much on my blog. I did do a video about a year ago about the cardiac event monitor that I wore, but I didn't talk a lot about the heart issues that I had. Um, so I was diagnosed with cardiomyopathy, which was basically heart failure, in June of 2014. And since then, I have done a lot of research on heart failure and the specific kind that they thought that I had, which was peripartum cardiomyopathy, which basically just means heart failure caused by pregnancy. And it's actually more common than you would think, even though people don't really look for it. So I'm kind of doing this video to raise a little bit of awareness. It can happen up until about 5 months postpartum even. So basically with mine, I didn't have many symptoms. I had really bad back pain and went to the cardiologist just to kind of rule it out. I ended up getting an echo just to make sure everything was okay, and it turned out my ejection fraction was about 25%. So, just to give you a little bit of an overview of what exactly heart failure is, when I was told I had heart failure, I was shocked because I, for one thing, thought that only older people got it, and also thought, heart failure means that your heart has failed, basically, but that's not really true. Basically, what it is each time your heart pumps, it's pushing blood back out, and if your heart is weak, then it doesn't push as much blood back out, and so a normal healthy heart will push anywhere from like 50 to 70% back out, and mine was only pushing 25% out. I immediately was started on some beta blockers, and I actually was started on an ACE inhibitor, but my blood pressure was dropping so low from the two medications combined that pretty much every time I stood up, I would almost pass out. So I stopped with the ACE inhibitor and was on the beta blockers. This was particularly devastating because when I was diagnosed, it was just a month after my son passed away from CMV, and that on top of being told you have heart failure at 30 will really turn your world upside down. It was a really, really rough time for me, and I was also told that I probably couldn't have any more kids because they really weren't sure what caused it, whether it was the pregnancy or the CMV. I always thought it was the CMV, but there was no way to prove that. So there is a condition called peripartum cardiomyopathy, which basically means heart failure caused by pregnancy. And it's very common. Well, I'm not going to say it's very common, but it's more common than you would think, being that we never hear of it. And it can occur up until about 5 months postpartum. So, anyway, a lot of the symptoms are shortness of breath, and you can't breathe as well at night if you're laying down, and swelling and of your feet and legs and stuff like that, which is also symptoms of third trimester pregnancy. So it's really, really hard to tell the symptoms up, beforehand. So having an echocardiogram on your heart is the best way to really know what's going on. That diagnosis has been one of the hardest things that I've gone through, and I think that's probably why I haven't talked a whole lot about it, because it's been very difficult for me to talk about. Luckily for me, my ejection fraction jumped back up very quickly. In June of 2014, it was 25%, and then in July of 2014, it was up to 42%. And by October, it had pretty much gone back up to normal. It was about 50 to 55%. And then when we decided to try to get pregnant again, it was normal. So it's about 55. And then luckily, when I was pregnant, I had one done at about 20 weeks, and it was up to 60%, which was awesome. And, since I've had Penelope and my heart is doing really great, it's really a blessing and a miracle because I was very high risk. Even during labor, we stopped pushing long enough for them to do an echo to see how my heart was handling everything, and we definitely had a lot of precautions. It can be very serious. Women have passed away from it. A lot of times people have to wear these like life vests where, they basically resuscitate your heart when it stops. People have had to have just all kinds of things, have been in the hospital and the ICU, and sometimes the second time, like, if it had happened again this pregnancy, then it would have been worse and I may not have recovered from it. And, so getting pregnant again for us was a big risk. A lot of people think that I was so high risk because of the CMV, the chance that that could happen again to the baby, but really, that was part of it, but I was really super high risk because of the chance of the heart failure again. A lot of times if it happens in pregnancy the first time, then, well, not necessarily the first pregnancy, but the first time that it happens to you when you're pregnant, the chance that it would reoccur is 50%, and it can be pretty dangerous. So currently, I'm doing really, really well. I didn't have any complications whatsoever in my pregnancy, and at this point I'm about 3 months postpartum, so I'm not totally out of the water yet, but I'm feeling great. I'm doing great. My heart seems to be doing great. My heart rate is down. It was averaging, it was like really high and about 120-ish, and now it's down to like 75. I'm still taking my beta blockers. I'm on metoprolol. But other than that, things are doing really well, and it's, honestly the best case scenario that could have possibly happened. So, but I do encourage you to just be aware of the symptoms, especially if, after you deliver, that's when a lot of the chances that this could happen to you are. Basically, during pregnancy, you have a lot of fluid built up, and then after you deliver, you've just got all these fluids floating around in your body, and they sometimes don't have anywhere to go, and so they end up around your heart, and your heart has a hard time getting rid of it. So, that's really the concern. And also, like, for those of you that don't know about congestive heart failure, that basically means that your heart is not pushing out enough of the liquid, and so it's getting into your lungs, and that basically suffocates you. So that's what, really the dangers of heart failure are. So anyways, I'm sorry to bore you guys. This video ended up a lot longer than I meant for it to, but I did want to share this pretty serious and personal journey that I've been through. So thanks for watching. Let me know if you have any questions or if you've experienced anything like this.